My name is Kavitha Chinnaiyan, and I'm a cardiologist at Beaumont Hospital in Royal Oak. And the CQI that I'm leading is the Advanced Cardiovascular Imaging Consortium. Advanced Cardiovascular Imaging Consortium is also called the ACIC, and this CQI actually encompasses currently 47 hospitals and imaging centers across the state. And the purpose of this entire effort for the last 4 years, since its inception in 2007, has been to establish best practice of coronary CT angiography across the state. And the CQI, the ACIC, is basically trying to examine which patients actually benefit from the CT and who should not be getting the CT, because it's a radiation-based test. One thing that we've seen as a result of the CQI is the usefulness and the utility of coronary CT in patients with prior stress tests. And we did a kind of a retrospective analysis of patients within the ACIC to see, how useful is this test? Or are we just adding on another test without really bringing any meaningful information to the table in the diagnosis of coronary artery disease? And we found that actually CT is great in these patients. So that's one aspect. And the collaboration aspect is very unique and very important of anything that's going on in the country right now. And one of the things we're doing as part of this best practice is to actually establish appropriate use of CT across the state. And as you might imagine, this is a difficult task to do because we've seen just within the ACIC that there are about 5,000 referring physicians that refer their patients for a CT at one of these 47 centers. And trying to educate all these 5,000 physicians on when to order the CT is not an easy task. But we've taken that on, and actually, we've shown recently that such a collaborative educational effort really pays off in the long term. So in the last 4 years, we've seen an increase in appropriate use, a decrease in inappropriate use, and things are going in the right direction. One thing that I'd like to see going forward with the CQI is to include other imaging modalities in it, because we've demonstrated a change in appropriate use in CT, but we don't know if this has influenced these patients getting other kinds of tests that we are not looking at within the ACIC.